technique for negotiation or for persuasion is that one, you first must validate the patient's emotional state, that what you're saying is reasonable. That's a reasonable perspective, that okay, that sounds, it's okay that you feel that way. Number two, you must use emphatic. Emphatic means strong language, like strong language to highlight the risks of non-compliance. And you can ask, like, you can do it in various ways. Either you can highlight it by a statement that I'd like to advise you that there are risks associated with what you're doing presently. It can lead to so and so. Like, for example, if your patient is obese, you can highlight the risks associated with obesity, that if you don't watch your weight, it can lead to some diseases in the future. And in order to avoid that, you would need to maybe make small changes. And if that's not something that you're comfortable with, whatever you're advising, you can probably modify your advice and then check their opinion on this, that what do you feel about this? So step-by-step technique would be, one, validate their emotional state, that yeah, what you're saying is reasonable. That's a fair perspective. Two, highlight the risks, tell them what it can lead to, how it can impact their health. Three, talk about what sort of things they can do. Talk about the benefits of what you're proposing. And if they're not accepting of what you're saying, then try to change your advice, something that can, you know how we say, find a middle ground, something that you're both comfortable with, like shared decision making. So then change your advice slightly and then check the patient's perspective on it. That, how does that sound? Is that something that you'd be able to do?
Yes, ma'am.